Dr. Aquavella's nickname has been the Energizer Bunny. He just has such enthusiasm and dedication. He's always the first one into work.
Jim is someone who lives by example, has done so his whole life, and I am going to have quite a task ahead of myself to follow his example, both in terms of research and just his philosophy and his approach to life and to work and to service.
He is a pioneer. He is a leader. He's thoughtful, empathetic, mentor. Anything that you need, if you reach out to him, he'll make it happen.
Dr. A is my uncle by marriage. He married my Aunt Kay. My father passed away at a fairly early age, and Dr. A just stepped into the role as our father figure. We can call him day or night. He's always there. He's like the fixer of the family. My Aunt Kay and Dr. A met. She was a nurse. They met, I believe, in the operating room. And they connected right away. And they had this passion to create this ambulatory surgical center, which, against so many obstacles, they got it done. It was amazing.
I've known him now for so long, and I really look up to him as one of the founding fathers in the corneal subspecialty. And I will continue to look up to him as a teacher.
In the year 1976, I came to Rochester to do a fellowship with Dr. Aquavella. I think he was one of my mentors who influenced my life quite a bit. The way you talk to the patients, the way you give confidence to the patient that you are the doctor for that person.
He had empathy for the entire family of, say, children who were losing vision. He understood that this wasn't a disease of one patient, but this was a process that the whole family had to go through.
He has this board up in his library at home. He calls it his baby board. And it has all the babies on there that he's operated on from all over the world. And then so many parents give updates on their children. She's able to ride a bike. My son is playing soccer, would have never been able to do this without your help.
Dr. Aquavella had a very loyal following, and it wasn't unusual to have a patient that we shared and say, is this the same Dr. Aquavella as treated my grandfather? And the answer was yes, it was.
Ultimately, I think I've heard him say that he is a scientist and a clinician. Scientist should be someone who strives to uncover the greater truth. And I can't imagine anyone who does it and has done it more consistently than he has.
I've been fortunate to go to so many places, countries with him. We were just treated like royalty. People started just to bring their babies up to him on the street, wanting him to heal them. He was just regarded as like this miracle worker. Everywhere we went, people wanted him to look at their children to see what he could do.
I think most doctors that are in the field love medicine, and Jim loves it, so why not continue doing it if you still have the passion and desire? And certainly the faculties haven't left him. He's just amazing. Thought process still is sharp as a tack.
I would say that what drives him to come in every single day is that he feels he still has something to give and something to accomplish. There are still problems to solve.
So he's got fellows literally around the world, and then they are bearing fruits. They are be a second generation cornea specialist that can trace their lineage to Dr. Aquavella. So that's a tremendous legacy.
What is most important to him is that he pass on what he knows, what he discovers to the younger generation, and make sure that they learn to pass it forward as well.